So first of all, welcome everyone and to this first webinar of SHAFE. SHAFE Explained. It's the first public webinar of Net4Age-Friendly. It has been organized mainly by Willeke, thank you for this, and by AFEdemy. As I was informally explaining, we'll have two parts of this webinar. The first one will be more devoted to what's SHAFE, and the second part will be presented by Willeke, and it will mainly aim to provide some hands-on examples of SHAFE being implemented. I would ask you, in terms of etiquette, if you please can all be muted during the presentations, and then after this first part of the presentation, we'll open for questions, and you are free to talk and to discuss, and in the second half as well. But during the presentations, please, even for the sake of the video, we ask you to keep muted. Probably most of you know, but for the outsiders, we have a COST Action NET4Age-Friendly that has as its grounds the concepts of SHAFE, which is smart, healthy, age-friendly environments. And this will be, this webinar will intend to serve as an explanation of this concept, because this is, of course, fundamental to understand the rest of the action. And we hope to evolve from here and progress on SHAFE also based on the work of Net4Age-Friendly. So in terms of the background and getting started, sorry, this passed too fast. In 2017, we were discussing among a group of people that everyone was trying to progress with people aging in their own homes. We were talking about having as much as possible older people out of nursing homes, having a lot of the healthcare provision being provided either with technological tools, as well as outside of the hospitals or other organizations of care. But of course, this means that a lot of other things are necessary, because it's not enough to just ask for home-based care. So at this time, we were considering that there were a lot of different issues being in the table. And of course, at one point there was technological development, but a lot of the conditions also had to do with the housing conditions. So we were thinking, how do we align technological with the building industry? Because these usually are not areas that talk that much. And at the same time, bring also health and care, health and social care to this discussion, and having the four areas talking together in terms of policy making and also in terms of funding, so that we could have a more efficient healthcare system and, of course, more efficient with more quality. So this discussion led us to propose to the European Commission a thematic network, which was called Smart, Healthy, Age-Friendly Environments. And the idea was to bring as much as European organizations and national partners involved to discuss what was needed to bring these four areas together: technology, building environments, health and social care. With this, we actually could bring in a lot of different organizations. Willeke and I coordinated this thematic network. It was approved, and it was one of the first ones that brought together different DGs, different directorates general from the European Commission. So it implied a big discussion, a big coordination between DG Sante from Health and DG Connect from the technological side. And it was approved with 11 main partners, so the two coordinators and 9 networks. And over the time, it gathered around 160 organizations as formal partners. And with this work during the year of 2018, we delivered to the European Commission and the member states a joint statement and a framing paper, explaining what was the background and what were the policy recommendations for the implementation of these environments that brought together these different areas and were able to progress on the provision of health and social care. After 2018, we had a lot of ideas and movements still going around between all of these organizations. And so we evolved to a stakeholders network in 2019. And this network continued with its partners. Yes, I was trying to pass the slide. So progress with these partners and more that join during time. A lot of you probably are part of this map, and a lot of you probably also accompanied and contributed to this shared vision of smart, healthy, and friendly environments. So because we needed an easy acronym to speak, we came to create this new word, which is SHAFE. And SHAFE means that you need to have 5 conditions to progress. You need to have this shared vision where the different areas of knowledge are brought together and align them in terms of cooperation and communication at the first time. So we need to have people talking, have as much as multidisciplinary knowledge brought together, and people need to understand each other. So they need a common language, they need to know a little bit from the other areas, and only this common language can make us progress. Of course, it's very nice if we all come to a common language, if we all agree to work together, but then if there is no money, we go nowhere. So, of course, this cooperation and communication cannot exist if there is no funding and conditions for implementation. So there is a part of policy in SHAFE, but there is also the need to implement it locally, otherwise it doesn't mean much. So for this, we see also 2 big areas that are essential. One is research. It needs to be fostered, and of course, blue sky research is impossible, but within SHAFE, we want to focus as much as possible on research for prediction and prevention. And we need to have citizens being empowered and actively participating in their own lives. So, of course, we don't mean to pass this by as a burden, but we do expect citizens to also want to learn more about their healthcare, about their participation in democracy, in the citizenship, to make to have lives where they do more exercise, where they are more literate, and only with this we think that local implementation progresses. So a bit coming from a summary of what we were discussing, cooperation and implementation are for sure the way forward to SHAFE after the policy that was already delivered. So in 2020, we, along with all the partners that wanted to participate, developed a position paper. And this position paper had the scenario of COVID, of course, also as a background. And we considered that on one side, if this was terrible for so many countries and in ways that we don't even know now, because in terms of the social and financial crisis it will imply for the next few years, of course, this was a very bad background. But at the same time, it also meant that at least the health and care provision that was necessary during the pandemic, a lot of opportunities came on for the digital world. So on one side, this is, let's say, 2021 is the opportunity year to foster the digital revolution, to try to push some of the implementation that we have been considering for so many years. But at the same time, we need to make sure that the physical and the social environments of individuals are considered in this revolution, and that we are aware that so many other things are needed in order to foster this implementation. So on one side, we have a big challenge to do this, which is we all need to be aware that we can only progress if we take our part of the shared responsibility on common good. This, unfortunately, has not been that much seen, for example, in the vaccination campaigns. So many times people forget that we need to pass by our selfish demands and go for the common goods, unfortunately, sometimes also as countries. But at the same time, we need to see the challenge as a need for all the citizens. And this means for the most fragile ones, for those that need to have special aids and special inputs from us. And at the very end, to try to see how we can promote independent living for all the people. Sorry, my presentation froze again. Yes. So this comes in line to what was being said. We are aware that the digital is not a solution for all the difficulties, but of course can be the right tool to implement it. So on one side, if we want to progress for the digital, we need to make sure that citizens have enough digital skills, they have enough health literacy, they have equal access to digital tools, which is something that is being so discussed in terms of the teleschool, for example. And of course, at the same time, this is not enough if the houses are not adequate, if there are not enough digital infrastructures, if transportation is not adequate to different types of people and their needs. And of course, on top of all of this, we also need to have the health and care system align with its needs and implement person-centered solutions. As you can see at this point, all of this is now translated into our Net4Age-friendly action. So, as we said, this was the policy approach in our joint statement. It is now our approach in the SHAFE position paper that we delivered last year. And we are now trying to bring very specific goals to it to ensure that things can be implemented. So we have some main actions that are already partly being implemented in different projects and that we want to foster during the next periods. On one side, and connected, for example, for the part of literacy, of support, and of community care, we think it is very essential to promote training of formal and informal caregivers on SHAFE. Also that we need to coordinate health and social care a lot more. We have been discussing integrated care for a long time, but sometimes it's not only to coordinate health and social care, it's even to coordinate all the different pathways that are needed, including the housing, including the environment conditions, in order to have a value-based approach. We need to have sustainable business cases with all the payers, either governments or insurance companies, or even private investors that can promote the implementation of innovation in our countries and regions. And we need to modernize education of all the professionals that work in these areas so that they know enough of all of the different areas that come together and need to be coordinated in order to implement these type of solutions. And of course, last but not least for sure, we need to support the public authorities and the providers to implement SHAFE. So we can promote all of these solutions, we can promote all of this knowledge, but at the same time, if the final payers, if the final implementers don't feel the need to do this more holistic approaches, then for sure it won't work. So the work of SHAFE and the work of Net4Age-Friendly is very connected to the local networks. And this is the reason why one of the main aspects of the action is the promotion of the regional and national ecosystems in order to implement SHAFE. So how many aspects do we need to take into account if we want to scale up and implement SHAFE? In the position paper, we came up with 7 measures that we feel that regions, ecosystems, member states, well, whatever the shape of your network is, need to foster actual implementation and to reach with solutions to citizens. So on one side, we need to understand what kind of financial incentives we need to work with policymakers to implement these kind of holistic solutions. And the same happens with insurance companies or other types of payers. At the citizen level, what can we ask? How much can we ask to citizens? What type of commitment in order to change their habits, their literacy, their lifestyles, in order to have more ownership of their health pathways? In terms of financiers, how can we promote these type of solutions in order to be invested in? And for the health and care providers, what is lacking? How can we promote more collaboration between the different providers in order to implement this? For the researchers and academia, can we promote, as we are doing in Net4Age-Friendly, more coordination between the different sectors, and how can this go back to all the new researchers and the new students in terms of their skills, in terms of their lifelong learning. Last but not least, for the building industry, can we make them start investing more in smart built environments? We do think so, because this is one of the areas that has been fostered. But as much as we work with all the different industries and with all the different types of stakeholders in SHAFE, we understand there's still a big and long pathway to be taken in order to have everyone actually working together. So this was the reason why Net4Age-Friendly came across. It's one of the angles of SHAFE. It's more connected to research, we know, but a bit differently from the usual COST actions that are very, very research oriented. In Net4Age-Friendly, we started from the beginning with having not only researchers, but a lot of different stakeholders. And you probably will understand this once you start knowing all of the group. We have people from civil society, from businesses, from local associations, and not only people connected to the academia, for example. And this is very important, because this is this interdisciplinary dialogue that we have been talking from the beginning. On one side, democratizing knowledge and having all the wonderful researchers in this area being able to pass their knowledge in an understandable way to the different types of stakeholders. But at the same time, because especially the grassroots stakeholders, those that work with people every day, can also bring a lot of interesting knowledge to the research and try to make it as focused as possible on what can be actually implemented. So, having this said, I will pass the floor to, oh no, sorry, I won't. So having this said, in terms of the Net4Age-Friendly network, this is the approach that we have, and that has already been explained, which is we have a quadruple helix approach, having citizens, public authorities, civil society, and academia together. We now have a very large network. We have almost 300 people involved and being interested in the network. And we will work around 5 working groups that go to this holistic approach of SHAFE. One on digital, one on integrated health and care, one other on user-centered inclusive design, then the business impact and sustainability. And these 4 working groups from 1 to 4 will be integrated in a 5th one, which is the reference framework, that will try to combine them and provide a combined approach for the upcoming years in terms of research, but also in terms of implementation. So now I am passing the floor to Willeke, and she will also explain and go through a lot of these different aspects of SHAFE being implemented. But until now, and because we agreed as so in the beginning, if you want to make a pause and ask for some questions, you have the floor, and we can have like 5 to 10 minutes break for your comments and inputs. If you want to ask questions and to interrupt, feel free. Well, as much as we can, let's try to do it in order, but just unmute and ask any question if you want.
Vivian here from Luxembourg. I don't actually have a question, but I got some thoughts while you were presenting, and I'm not new to SHAFE and Net4Age-Friendly, but some of the things I had forgotten is that one time when I worked in Scotland, there was a lot of collaboration happening at the local level, partly supported through joint funding kind of approaches that the UK was implementing at the time, which allowed the healthcare and local authority and the private sector and the volunteer sector to work together on some kind of solutions. And that since I've been in Luxembourg, that's something that I found was really, really missing, because a lot of countries like Luxembourg still very much work in their own little silos. You have the Ministry for Health, who has their own budgets and their own ideas. You got the Ministry of the Family that do their own thing. And very naively, beginning when I was back in Luxembourg, I actually tried to introduce the idea of to have some kind of joint funded projects, and yeah, the reaction was quite extreme. And I don't think it has changed much. So I personally feel that that's something that obviously Net4Age-Friendly will have to try to tackle, because if everybody continues just working in their own little silos, we can come up with very good things, but it's not going to be implemented. You know, we'll have to find a way of getting the decision makers, the politicians, and the ones that have the purse strings to actually set up something to work together. And once that incentive there, we maybe have a better chance. And that's a kind of a kind of thoughts that came to me while you were presenting, Carina.
Yeah, that's very true, Vivian. Unfortunately, you came from one of the best examples in the world, which is Scotland, to somewhere different. So you miss it for sure. But indeed, we really need to progress on this. And COVID either comes with an opportunity or with even a bigger problem to deal with in the future. So thank you. Do we have any other comments or questions? Otherwise, we can progress and then we can discuss in the end. Okay, so maybe Willeke, you pick up?
Yes, I can. Thank you. Thank you for your presentation and introduction of the bigger theme of SHAFE. I will present one of the spin-offs of the concept of SHAFE that we have granted in 2019. That is because we were thinking, okay, with the concept of SHAFE is very holistic and how to approach it. And so we would like to have it, give it more a concrete execution from how can you implement it in concrete details. So we started a project that is funded by Erasmus Plus, and it will last until next year, until the end of next year. And we are planning to develop 4 training modules on smart, healthy, build, and business for people who want to be a volunteer, working with SHAFE, and volunteer also in the sense of informal caregivers who that you are a volunteer, but you are obliged, a mandatory volunteer, and also people who want to earn their money from providing SHAFE services and products. And that is what we are currently developing these training modules. The trainings will be online, and they will be open access as soon as they are ready. We plan to have the first half ready at the half of this year. So in July, August, I hope the first half will be online. To start to develop the trainings, we collected some practices from several countries so what can be a SHAFE product or service. And from this collection, we made a compendium of good practices, and that you can read also in the Hands-on-SHAFE website, so that you can have more information on that. This is just a collection of what we thought in 2020, what we found, but of course it's not so good, but not complete, but it's just a start to make it more concrete. And now I have to control my screen. Yes. So as we said, we divided the SHAFE into 3 main modules of smart environments. That is the first one. And that is that we look at the digital and ICT applications that can be found everywhere, but that need to support the health and well-being of people. We focus on the use of smartphones, smart home technology, and outdoor smart technology, and give you some examples of what we found. For instance, the special tablets for all the adults that are available, so that people can use also with bad hands or bad memories. These are some examples that we found in the countries that we are working in. We also found it very important that we have some e-connections with the doctor, so that's also a digital solution that supports the health and support. We found the smartphone for seniors that are developed. That is also, if people have some troubles with the hands, for instance, hand trembling or visual impairments, that it can be used for people very easily and also affordable for all the adults. Then we also thought of the wearables that we can think of, that you can, for instance, they promote that you go outdoors and to find your way, but also to support that they are very motivated. Okay, now I want to get the 8,000 steps or 10,000 steps, so that we can support it. Also provides people security in the sense that it monitors your functionalities, so that you know, okay, now I'm doing great. This is also a part of the SHAFE concept. We also, a smart solution is, for instance, to secure the neighborhood watch. For instance, in the Netherlands, they build up in every neighborhood. They have used WhatsApp to warn each other for unsafe situations or people that are in the neighborhood that are not quite well. And it works very well. And also, of course, the social robots is also something that supports your health and well-being of everyone. Then we switch to the second module of the Hands-on-SHAFE training. That is the healthy environment, and there we focus mainly on the healthy lifestyle that people can afford. Carina also mentioned it. That is one of the main outcomes for the citizens also work on the healthy lifestyle. Medicines and therapies, how you can provide these and how can you use these. It's very important to support it for people if you are a facilitator or volunteer supporting others. And also how to take care of people. For instance, how do you deal with people with dementia or people with Parkinson or people with mobility issues? The good practices that we found was, for instance, just simple walking and running, being outdoors is very good for your health. The fitness trainings, you have several examples that provide very adequate fitness trainings where you can train your body. Meeting all the people, also very initiatives that take place. The networks, especially for people, patients network, so that people can meet and share their experience with it. Medicines and therapies, how to use it. And that's also in the combination with ICT, can also support the use of medicine and therapies. And for instance, also an example is the Rehabilitation Innovation Kit that also provides an online trainings and physical activity on rehab. The last module of the SHAFE, hands-on-SHAFE trainings will be the built environments. And there we focus on the housing, so that the housing that supports people to live independent and also support their well-being and health. Outdoor spaces and buildings that need to be secured and maintained so that people can go outdoors and participate in society. And mobility, it's also one of the parts of the elements of the built environment training course that we will provide. Some good practices that we found, age-friendly housing that is are developed everywhere. Here's some examples from the Netherlands and from Poland. housing advice, to have mobile housing advice that goes into the neighborhoods so that people can easily find the advice on how to adapt or adjust your house so that it can be more age-friendly. Dementia-friendly walking routes are established everywhere so that people can either go shop very easily, or that it's a kind of a remembrance route so that people can recognize the old things that they were used to. And of course, also very important is the outdoor safety and maintenance, how to cross the street if you have a walker, or if you're blindsided, if you have bad sight. So that is also very important that you keep these main. And at last, it was also that we focus on the sustainable energy housing. But we know that lots of older adults have very much troubles to keep themselves warm. So, and how can we save the energy so that it's the bills for them still, that they still can afford to live at their home and can pay the bill for the energy. And that was my part of the presentation. So that it just to try to make it a little bit more concrete. And thank you very much. And I hope you have also questions, debates, other examples that we can use. It is also very welcome. So please, I give the floor to you.
Thank you, Willeke. Well, to open the floor and activate a little bit of discussion, we would like to ask you specifically if there are any doubts, of course, on the way we framed SHAFE, but even more than that, if you have any additions, if there is things that you think you can bring in from your experience, if there are good examples that you know, or if there are areas that you think that are overseen and that we should consider and further exploit.
Yes, please go ahead.
So Willeke, and Carina, this is Maddalena speaking. I was just wondering whether in the build-up of the local ecosystem, you can suggest to start with one of the 4 relics, or for example, we start building from our university ecosystem that has also already connections in disease prevention and health promotion through local no-profit organizations, so that you can have a local ecosystem that starts building synergies around an existing core group that can be connected progressively with our COST Action, and start from there, progressively building from what is already in line with our principles.
Yeah, if I can say my opinion, I think what we need to do is to depart from reality, otherwise it will never work. So we will need to start from our existing networks, what we already have and how far we went, and then see how much we can introduce new knowledge there and bring new ideas and make people even go broader and engage with other stakeholders. But for sure, I think we need to start from the networks we already have and that we exploit them.
So probably an easy thing to do would be to extend the invitation to our upcoming workshops to our local network that we think might be interested in the topics that will be developed in the workshops.
I think so, yeah.
Sonia here. Hello.
Hi.
I don't know if it's maybe also could be an example. Willeke, you just mentioned this Erasmus Plus project. We have an ongoing Erasmus Plus project where partners are trying to help each other, both for the environmental side from the employees and also from the citizens, how to use these technologies in home care or in the nursing homes, and how to build up a trust to use these and to communicate, also to develop together the best solutions for example, wheelchairs or lifting, how to lift the persons out from bed, which is the best possible, how to do it best, because of the environment, in the different nursing homes, and for the best of all the employees also. And maybe it's much about education also.
Yeah. I'm very interested. So can you share the details with me?
Yes, I'll do that.
Yeah, perfect.
Okay, yes.
I think that today we also have the ambition of provoking everyone to the new webinars. So Sonia, that goes also to you. We intend to have one webinar every month. And I think that the first provocation to everyone can be, can you have something interesting to share? Are you interested to do it? And if so, we already have 2 or 3 webinars more or less predicted, but I think that for the rest of the year, it would be very good if 1 or 2 organizers came together and put like 3 projects to be presented to colleagues or networks or existing policy frameworks, whatever comes into this area of context.
Okay.
And to make it like today, we can record it and everyone can see it further, and that would be helpful for everyone, I think. So Sonia, maybe we are already
yes, maybe because our project manager, I think she will do it because everyone thinks it's a good project, so we can share it, of course. No problem.
Perfect. But also please to include it in the trainings that we are developing. It would also be very helpful. So if you can share before the webinar, then it would be also good. Yeah, thank you.
Yes. If I know the dates, then I will try to find something about it. Yes.
Yeah, perfect.
Add something?
Yes, sure.
I'm Yifat Rom from Israel. I'm an architect and a gerontologist, and I'm doing my PhD now on the connection between the physical environment and the well-being of older people. And I've been attending in many Zoom meetings nationally and internationally, and some of them are talking about the urban regeneration, which puts for us a very good point to implement all the things that we know, because there are now I have been in one which was very international. Everybody is writing now guidelines and things like that, and I think that as much as we can try and put things together, we will be able to make difference in all these guidelines. I thought about ways how to do it, and I thought, if you know, booking.com, you know, the site.
Yeah.
So if we would have been able to make a list of things, and then with parameters. So if I'm looking for a solution for this thing, and I will list the things that I want, it will lift up all our knowledge, what's existing in the world. And it takes a little bit of effort to build this site, but to put things in, us as experts, we can put the things in, and it can be really interesting.
Yeah, actually, that is that is, to my opinion, the main aim of the reference framework, where Pedro Rosero is working on, the working group lead, together with us all. Maybe Pedro, you can add something small, shortly.
You are muted, Pedro.
I was saying that I was trying to regain the sound, because I was looking at the other window. Yeah, what you are doing now in work group 5, and as we have discussed also in the last core group meeting, we are starting to organize a conceptual map where all the areas will be described. at least at the first stage, and all the groups can integrate all the groups will integrate their contributions. So all these topics will be organized in a more or less giant conceptual map at the end, but anyone is welcome to do, and definitely construction and built environments and the connections will be there represented. So some of the suggestions from the kickoff meetings were, for example, including existing ontologies on services, on disease, on care, or whatsoever, and that's what we are going. I'm going to do at the initial stage. Include some for provide some structure for the discussions.
Thank you.
But of course, all of you are welcome to join.
Yeah.
And the idea of adding other members from our existing networks that we were saying before is also something that we have challenged all the participants in the kickoff to identify who is missing, either from academia, colleagues, but also from civil society, companies, because at the end, the reference framework needs to combine all things holistically. We don't want to overpose to other groups, but we need to start organizing it in a coherent way to integrate all the knowledge from all the networks.
Is that according to what you had planned, Yifat?
What did you ask?
Okay, perfect.
Are you waiting for me to answer?
Yeah, I think.
Can you repeat your question, please?
Oh, sorry. I think what Pedro explained was what you had in mind.
Yeah, more or less.
More or less. Okay, yeah. Then you keep us posted.
Yeah, but
I'd be happy to talk to you and share my ideas with you.
Perfect. Yeah, please do it.
Yeah.
I think Bettina is raising her hand. I don't know if you want to talk, Bettina. You need to jump in when you want. Otherwise,
okay.
I'm sorry, but it's a lot of pictures, so sometimes we get lost. Please go ahead.
So I was thinking about your mentioning all the different kind of associations which are already together in the SHAFE program or in the SHAFE network. And maybe it would be a good idea to list up what kind of associations are within the European participants of our network for the 7 political spots you identified. Like, do we have policymakers? Do we have healthcare providers? Do we have citizens and all this stuff? And see who from which country with the association or with the background or with the network is in it. And then we can see for which European country we maybe have to add associations from this different kind of fields, so that we have an overview if the network already integrates all people who need to be in there for all different European countries, and give a clear maybe recommendation to the leaders of the countries to integrate these networks which are missing because the others have it, or to find out where these networks are and who you have to talk to within your country to enlarge the whole community of the network. This is one thing we can do, or maybe you already did this, but I missed it. So it would be great to have an overview which kind of networks are already within this project in the different countries, and what can we learn from these already included networks to share it with the other countries and get more like of these associations involved. So this is one idea I had while I was listening to you. And the other thing is that I'm always a bit struggling between the whole concept of getting this ideas into the whole community and into maybe whole, I'm from Germany, into whole Germany or into whole Europe, and the main part of the end users who are addressed. And I'm thinking about, do we integrated into the network all the associations of the end users that you want to address from the different European countries? So I guess we should do this, like just not talking within researchers, also talking about with groups of seniors, citizenships associations, which should be part in maybe in the working groups or whatever to help us to integrate their opinion and all these things.
Yeah. Thank you, Bettina. Well, one thing I can say, which is that at the end of last week and finalizing this week, we already prepared the proposal for all working groups to do some mapping. And this mapping is exactly of what exists in each of the countries and how. It is not always simple to understand who we represent because, as you know, Net4Age-Friendly demands a personal affiliation and not necessarily an organizational affiliation. So sometimes you can be representing different types of stakeholders, or you may even be only there as an individual researcher. It's not the same as SHAFE because SHAFE asked for an organization and not a person. So we are trying to combine things and try to understand how to go. In the proposal, we did this. We asked everyone to say who they represent and we segmented it. But now that the network is growing, maybe we need to do this mapping again, at least trying to have everyone to propose what they are, what they have in their own country, and what is missing. I think this is a good suggestion to include in our mapping. Of course, end users at the end will depend on us bringing them in because Net4Age-Friendly is a cost action. It's not really accessible sometimes to all types of end users because you speak English, you have a very research-oriented approach. So we will need to see probably to integrate them through our organizations or affiliations or etc., and bring to the discussion people that are okay with bringing their inputs in this way. Otherwise, what we can do is to have our local sessions with different types of stakeholders and bring the results to the network. This is also a possibility, I think. I don't know if anyone wants to add something on this.
If I may, hello everyone, my name is Alexey Andrushevich. Someone of you know me, and I'm very happy to see some people with whom I worked also before. I come from Switzerland, present iHome Lab and also spin-off from Smart Home Laboratories. And yes, I think this is the way to go for the local communities. I mean, if we also talk about living labs, right? I mean, approach of living labs. So where they are locally co-designing or co-developing some solutions. Also, I liked very much in your slides, Carina, the quadruplex helix innovation approach, where you have different stakeholders, right? So basically, I think the ideas are there. I mean, they are already kind of the initial ideas are there. So now we have to think, how do we structure it how do we give a bit more structure, and then how to implement it in a good way, right? So I think that we think about similar ideas. The question is how it evolves on the practice. So, and again, congratulations. I'm very happy to work with all of you in Net4Age-Friendly COST Action as well.
Perfect. Happy to have you as well.
And of course, greetings from Rolf Kissler as well. Yes.
I don't know if we have other comments. We are reaching almost the end of the hour. Maybe we can try to make a wrap up and say that in the chat There are at least 2 links there for papers that we referred to. As Willeke said, this session is being recorded, so you will have access to it. But we'll also share the PPT in form of a PDF with everyone. And at least 2 or 3 main topics we take from here, which is maybe we need to spread this word very clearly that we will aim to take advantage of the existing networks that are already there in each country, in each of your organizations, to map them and see what's missing, and to try to bring good examples into the network. And one of these aspects on top of the mapping is also that you can bring this good practices and this existing networks and knowledge that you have into webinars and present them in our action. There is actually some room for funding this, we think. It's one of our ongoing proposals with the COST Association. So if you have the possibility of hosting these webinars, be in touch with me and Willeke, and we will try to put this together, because at this point, what we can do the most during this year of COVID is to share our knowledge with each other. And this is probably what we can do the best until summer, I think, hopefully. So, yeah, let's hope.
Yeah.
So it was, from my side, I took this main aspects, but please, if you have others, you still have time to jump in. Otherwise, I will pass the floor to Willeke to close.
Hi, this is Paco. So as some of you know, I'm the chair of Good Brother, different COST Action, and I'm also a member of, I don't remember how, A-Step is number 04, 19104, that is on technologies for people with autism and intellectual disability. So I think that in these reviews that you are intend to do related to technology or smart homes, I think we can create synergies between the different COST actions, because in all the different COST actions, we are going to review the different technologies. In my case, in Good Brother, it's only about video and audio for assisted living. But I think that we can complement each other. We can provide inputs for the different documents.
Yep. Very welcome.
Yeah, that's very good. I think we have some overlaps of members also in your action, as well as Sheldon, which I think Francisco is now about.
Hello. Yeah, I just wanted to say the same that Paco said. For those who are not familiar with Sheldon, because I see in the list of participants today lots of members of the management committee and contributors of our Sheldon action, like Paco. The aim of our action is to create a network of solution developers for aging well at home, in the community, and at work. Sheldon is about to finish, because it started in 2017 and it's going to finish at the end of the year. But I think we are going to request for a period extension due to the impossibilities of having activities in this last period. But of course, it will be important to have synergies between among the three COST actions in this regard. Okay.
For sure. Maybe we can do a joint session somewhere during this year and share some knowledge between us and some results from your side, at least, because you are the one almost ending.
Yes, of course. One of the most suitable events would be to arrange such a kind of co-located event among the three actors, but due to the scenario, I think it's not going to be very possible, at least during this year. But hopefully, let's see if during the next year we could arrange something nice among the three of us. Okay.
Yeah, perfect. Thank you.
Okay. And I think we are very well in time to close the meeting because it's 2 minutes before 2. Unless someone has something to share with us. If not, then I would like to say ciao to everyone and see you next time. I think we will, on the 16th of March at 11 o'clock in the CET, we will organize a meeting with Irina Calderon about the green paper on aging. And so that you are already invited by now, but I will send out the invitations by e-COST.
What time is it? Sorry.
At 11 o'clock in the morning.
On
CET. CET. Yeah, on the 16th.
On the 16th
of March. Yeah.
We will send the information tomorrow. Yeah.
Okay. Thank you very much for joining. Oh, Robert want to say something? Oh, thank you.
Thank you all.
Thank you all, and we'll meet each other soon.
Ciao.
Ciao.
Bye.
Bye.
Bye.